next presenter, Joe Moreau. And Joe is the CEO of AltaPACS, which is an independent firm that supports the IT needs of radiologists and physicians through the use of the SuperNet. And I will let you go, Joe.
Well, thank you very much. Appreciate this, and my thanks obviously to the organizers for inviting me in to talk with you today. I hope you can all hear me, and I'll try and be brief and to the point. And I want to pass along my congratulations as well to the organizers. This is quite something that you put together, so I'm very pleased to be here. Just a little bit of background on who we are. We are a private firm. We're based here in Calgary, Alberta. Created in 2003 to really provide a managed IT service for the radiologists that we look after. Effectively, we service both the creators of diagnostic imaging and also the consumers of diagnostic imaging, primarily in Calgary, but we are extending this out to rural Alberta, which is the focus of my talk this morning. Our main clients are the two largest radiology firms in Calgary, Radiology Consultants Associated and EFW Radiology. Together we comprise 80 radiologists, single largest set of organized radiologists in the country. We do a little over 1.5 million procedures a year that we interpret, and we do about 95% of all of the imaging that's based in Calgary. Both in the hospital side and also in the community side, to service the family physicians. The core of what AltaPACS does is we design and we implement and we manage all of the core major systems for diagnostic imaging. This will include the order entry systems, the image management systems, the reporting systems, all of the network infrastructure that's required to make these big fat files go through the networks to and from our locations, as well as all of the other key components in terms of the servers, etc. So we're a full-service firm. Our core competencies in our firm are around clinical practice. So we very much understand how a digital footprint can change and can optimize workflow in a clinic. Obviously, technical design is very important. And the last piece around it, which I can't understate enough, is expertise and integration. There are some significant investments that hospital districts and communities have made in this province to beef up their ability to do diagnosis using diagnostic imaging. And our aim is to tie into those systems and integrate so that we can help the patients, not ask you to reinvent and reinvest every time we work with you. So just in terms of rural community and how we focus on that, what we do know is that the rural communities either have already or can staff up to perform many diagnostic imaging procedures. A lot of the communities that we know of, also, they have x-rays, they have ultrasound machines, and the cost of these machines is actually starting to go down and the power of these machines is starting to go up. So the access to it is very it's starting to get easier to get to. But there's no value in these machines unless, of course, the referring physicians have the ability to get the reports coming out of these diagnostic procedures and the images coming out of these modalities very quickly. And so one of the diagnostic imaging is one of the three ways that a referring physician is allowed to work with the patient. And determine what their issues are. So obviously they use their expertise in their own examination. They can use laboratory to understand what's going on. But diagnostic imaging is becoming more and more a very dominant method of understanding what needs to be done to treat the patient. So if there's a lag time between the time that an image is taken and the time that a report is provided to that referring physician, and that lag time is severe, it doesn't really do the patient much good, and the referring physicians can get some level of frustration. So what we really are focused on is report turnaround time. So it is the ability to have the image taken in a clinic, wherever it would be in rural Alberta, and have a report about what is going on with that image or what the diagnosis is from the radiologist in a very, very short period of time. Often to the point where we can have that done while the patient is either in the clinic or in the hospital itself. And the reason for this is then we can understand what the pieces are so that we can move the patient along to the next level of clinical assistance that we need to do. So traditionally in rural Alberta, because we've had to move the radiologist to the place where the images have been taken, the report turnaround time has been quite lengthy. And there's also been times where it's been anywhere from 36 hours also to a point where it's been up to 10 days where a radiologist would return and read that report, which is not effective. There's also been some more important modalities that have come out, such as computed tomography or CT and MRI, which have traditionally been reserved for larger metropolitan areas. And so what we want to try and do is see if we can bring some of these modalities out to rural Alberta. So we've started to work with some of the regions, Aspen and East Central Health in particular, just to provide two examples to you as to what we've done in the last sort of 6 months. Aspen and East Central Health collaborated in the beginning of this year to provide a mobile MRI machine to 5 rural communities in Alberta. Communities include Hinton, Westlock, Lloydminster, Cold Lake, and Camrose. The truck goes to each one of these centers, and for a space of a week, we'll examine patients using MRI technologies for some more advanced diagnosis. The East Central Health, back in about March, required a new set of reporting radiologists on a 30 days notice because the existing group decided to patriate their work more towards a major center. So they approached us and asked us whether we could help them provide diagnosis and reporting facility for their work, approximately about 30 to 50,000 exams per year in East Central Health. And what we've done is we've basically created these two environments whereby through the mobile MRI or the X-ray, the orders that are coming from the hospital system and all the images are traveling now by the SuperNet and to my data center in Calgary, where we're serving these up for the Calgary radiologists who are actively working and participating in managing these queues, and such that the reports can then go back to the local hospital systems electronically. The entire process from the time that the image is captured to the time that the radiologist is able to receive it and the report transfers back is all electronic from the standpoint of the hospitals and that we're working with.
Joe, we just have about another 30 seconds. I apologize for interrupting.
No problem, it's coming. So basically what we've been able to do is that we've now been able to bring MRI imaging to rural communities. We've reduced the lengthy trips and the wait times to the major centers. We've reduced X-ray and ultrasound turnaround time from 36 hours to 10 days to less than 2 hours 80% of the time. And as a matter of fact, last week we did a test. We actually can do reporting now in under 30 minutes with some new technologies we're bringing together. It's been a significant improvement in patient care, and we've been able to proactively notify referring physicians in the communities about cases with complications much quicker than we were able to do before. We've got 40 radiologists in our pool. We can actually expand that pool to 80 radiologists with subspecialty expertise, which has traditionally not been available. And the administrative costs, of course, have gone down significantly because everything is electronic. You won't be able to see this cartoon, but it says the physician's either looking at the guy saying either this is the wrong chart or, well, let's just hope this is the wrong chart. So in other words, we have to make sure we get the referrer the information he needs. And in summary, just wanted to let you know that we can today provide better patient care for rural communities with advanced technology. We can provide that through the SuperNet. We have access to any point in the SuperNet to drop any one of these technologies in there and can read it. And we are underway with more expansion. As a matter of fact, we will be bringing this service to Siksika in the First Nations starting December 1st, and we're open to do more of that anywhere in rural Alberta. Thank you.
Thanks, Joe. It's a much-needed service for the rural facilities, and Joe has provided his email address for anyone who would like to get in touch with him to discuss this a bit more.